Dr. Ruel, and I'm going to be presenting about a device that I've made. I have no financial disclosures and no conflict of interest. As a resident, I've noticed that relative afferent pupillary defect is a sensitive indicator for optic nerve dysfunction and requires a dark room and a good technique when using a swinging flashlight test to detect it. But often the relative afferent pupillary defect is missed by staff and doctors alike. And there is a high inter-observer variability because of the same. Currently, there is no way to document the reflex in an OPD scenario, and there is no existing portable device to use in a cam setting. So my solution was to make a simple, handy, portable device that anyone can use to assess and record the direct and consensual reflexes. So we achieved the darkroom settings using a virtual reality set. We eliminated the pupils within the VR set using infrared LED lights without stimulating them. We captured the image of the reflexes using two small Wi-Fi enabled cameras, and we elicited the reflex in each eye using LED light bulbs for each eye. So as you can see, these are all easily available materials. The making of this device called the PUpilmate essentially involves 4 steps. One is the outer covering, the box, then adding these infrared light circular boards, which we used initially from old CCTV cameras. And then coding ESP32 cameras, which are nothing but Wi-Fi enabled cameras, small camera chips into the device. And then adding an LED light source in each compartment of the device. Now, if you were to make this PUpilmate by yourself, all you need to do is to cut out a cardboard in this shape, add the circular infrared LED light boards, place the ESP32 cameras in between them, and add white LED light bulbs for each compartment, and then just fold the device onto itself. As you can see, the cost of making this device is quite cheap, and it won't come to more than 2,500 per piece. So this is when we made the device at a hackathon event in Pondicherry, and it was a rudimentary version, as you can see. We modified it a bit and used it in this study called the Pulse study, where we compared it versus a swinging flashlight test. It was a cross-sectional study done in a Neuro Ophthalmology clinic, and a systematic sampling of every 5th patient was done. There were 80 such patients, and 80 such videos were recorded, each lasting 15 to 30 seconds. Each video was also graded for quality. So this is an example of the reflexes done on me. You can now look at the screen on your right, and then on your left, and then on the right. So each reflex can be seen. This is a video of the RAPD eye. Look at the normal eye reacting, and then immediately look at the RAPD eye immediately dilating. Similar video, look at the normal eye reacting, and then see the RAPD eye dilating. So this was done on around 80 patients, with females more than males, and this was our age group between 20 to 80 was our age group. We saw that the PUpilmate had a sensitivity of about 0.97 with specificity of 0.96, and there were some minor aberrations when it comes to optical quality of the images, with few major aberrations as well. There have been other smartphone-based LED pupillometers that have been described in literature before, but they're all uniocular, not able to do relative afferent pupillary defect screening. And none of them have been made in India as of yet. So this device can be used to screen for an RAPD and therefore pick up neuro-ophthalmology patients and prevent them from wrongly being dilated in an hospital. And you can document an RAPD at the first visit and document for medical legal purposes as well, just like a fundus camera. In future, it can be used for monitoring of neurocritical care patients, predicting a raise in ICP before it happens. And this is the first do-it-yourself Indian-made pupillometer as of now. There are Indian pupillometers, but the first one can be made by yourself. It can even be used by an optometrist or an ophthalmic assistant after training. Conclusion, there are no currently feasible ways to detect or record pupillary light reflexes at an OPD or CAM setting, and our device just costs around 2,500. The PUpilmate shows promise in detecting and recording an RAPD for both OPD and documentation purposes. And grading of the RAPD can be done by reassessing the recorded video. These are my references. Thank you.
Okay. The resolution of the pictures which you showed were not very good, like
Yes.
which you see with the naked eye.
Yes.
So what extra advantage do you think? You can even record with a smart camera with little magnification as such, and which you can see after the recording. So how do your device add more to whatever we are doing at present? Because you are not able to pinpoint, mark it, measure it in your device, right?
Sorry?
You will not be able to measure the amount of
Yes,
reaction.
as of now,
right?
we can't measure the amount in this version. In our future versions, we're planning to use a better processing software, something called a Raspberry Pi. This is because of the frugal nature of the device that limits the applicability of measuring and grading using neutral density filters. But hopefully in future future versions, we're planning to incorporate the same. Secondly, when you're using uniocular pupillometers, when you switch from one side to the other, the light conditions will change. You won't have optimal lighting conditions. Your timing of the switch can change. All of this is unstandardized, and therefore a binocular pupillometer like the one I've shown is much better.
And what about the light? Source of light is quite focused one, or it's a quite diffuse?
It's just one
The
LED.
stimulus light you said, no, that's a white light you use for the stimulation.
Yeah,
It's a focus light or it's a diffuse light?
it's a diffused light.
And is there any it's a uniocularly you are testing at one time?
At one time uniocular and then moves on to the other.
Other eye, okay.
Any questions from audience side?
Now we move on to the, okay.
Yeah, so I'm asking, yeah, so essentially that is definitely a drawback, but essentially I asked them to look straight. It's a closed box and it's black. So there's nothing to fixate on. It's all dark inside. So they technically will be looking into distance and convergence won't be affected.
Will they not focus on the light? That one, like.
Yeah, maybe. But then the light is located laterally, so that technically won't cause a constriction. So
And patient would be looking at a distance. It's open, anteriorly.
no, it's a closed box.
So then accommodation factor would be there. The near reflex would be there.
Only, that's what I said, the light is not located in the center, it's located a little laterally for each compartment.
But still there is a blockage in front. The patient would always like to see something, anteriorly. Either in every pupillary reflex testing, it's a important thing. Patient has to look at a
focus
distance.
at a distant object, I
and we
understand.
throw the light from the side.
Yes.
But there is something, cardboard is there, white sheet is
It's
there.
a white sheet, but it's dark.
Definitely, when something is there, you have a tendency to look at it.
I
To
should have
make
brought the
something, it should not be there.
There will be proximal convergence which will come into
Yeah,
picture.
definitely.
And there will be some people
Okay, maybe.
because of that.
And patient would like to accommodate definitely. So that factor has to be considered. Okay? Yeah.